whatever is your background, pharmacology remains a common connecting subject, whether you are from medicine, from pharmacy, from nursing, or any other background. Pharmacology plays a very important role. If you are working as a medical affairs professional or regulatory affairs professional, definitely pharmacology has a big role to play, right? And understanding the basics of pharmacology definitely helps all of us to do much, much better in our career, right? That's why we have with us Venkat sir. Venkat sir comes with over 20 years in regulatory affairs domain in the pharmaceutical practice, and he has done his MS in pharmacology, right? He has been a proud pharmacist, and he explores ways to, share his knowledge and learnings in various domains of not just pharmaceutical sciences but also pharmacology. So when I requested him that some of the students and participants are facing difficulty in understanding pharmacology, he immediately said, let's do a session for them and let's clarify their doubts live online. So let's welcome Venkat sir on this session. And you'll know more about Venkat sir in upcoming sessions. We have a lot of sessions planned going forward. And everything depends on how actively you participate in this session today and next upcoming sessions. All right. So let's welcome Venkat sir. Welcome, Venkat sir. Thank you so much.
Thank you, Manoj sir. Thank you. Hello, everyone. Thank you very much for joining this session. Hopefully, by the end of the session, I hope you will learn something from today's class. Just to tell you about my background, I'm a regulatory affairs professional. So regulatory affairs is a vast area. It covers many streams. So I work mainly in the quality area of the regulatory affairs, which is mainly talks about chemistry, manufacturing, and controls. Okay, so the drug substance properties, and then the manufacturing process of the product, and also the analytical technologies,
Yeah.
stability, etc. Okay, that was my core area. Yes, academically I'm pharmacist, B Pharm, and then masters in pharmacology. I did it in UK. So though I have done my master's in pharmacology, I have never worked in that area, pharmacology. So I hope I can be able to tell you some basics here. Okay. And maybe if you want to proceed, I can take you to the next level as well. We will see, okay, how it goes here. Just before I start my session, I would like to understand mainly the objective uh, to learn the pharmacology from your side. So if any one of you, recently completed your graduation or post graduation, what is your objective? And also would like to know if any of you are already working in that area, or maybe in other area you want to switch to this area. So just kindly give me a little background so that I can understand where to start. So if you want me to start, at the basic, then I'm happy with that. Or if you want a little bit higher, so it helps me to where to start.
Okay.
So kindly
Uh,
feel free to tell me
yes,
what
absolutely.
exactly your qualification, what is your objective as well. Yeah,
Right.
from
So
this
two
session.
things I want from all the participants. Thank you so much, Venkat sir, for that.
Yeah.
Please put your qualification. So if you're, let's say, B Farm, just say B Farm, and maybe what is your challenge in pharmacokinetics, right? And maybe one liner is fine, or a few words are fine. This is just to understand the audience here, and accordingly, Venkat sir will tailor the presentation for all of you. Presentation in the sense interaction with all of you, because if he understands what are your current challenges, then it becomes easier for him to address those challenges, right? And please feel free because this is an interactive session, and we want all of us to learn from his interaction, right? When you interact more, when you ask more, the only thing that happens is learning, right? And these sessions we spend a lot of time in planning and executing these sessions. So please be active participants throughout and try to learn as much as possible. You can simply scribble the challenges you are facing, and then maybe if you want to if you want me to unmute and talk, just raise your virtual hand on Zoom. I'll unmute you, and then you can ask the question. This is supposed to be a Q&A. So the more questions you ask, the more learning happens. And of course, Venkat sir will walk you through the ADME process in pharmacokinetics, and then let's try to learn with him. Thank you so much, sir.
Yeah, thank you.
So Dr. Mansi is from dentistry. What about others? Anybody from MBBS, pharmacy, nursing? You can just mention your qualification. Let's try to understand the audience. That helps us to, customize the session with you. Medical, that is MBBS. Sakshi, thank you for messaging. All right. Prajwal says M.Pharm, pharmaceutical chemistry, PG diploma, regulatory affairs, and internship experience in global regulatory affairs from Eli Lilly Company, Bangalore. Perfect. Thank you, uh, Prajwal, for that. Santosh Kumar, M.Pharm, pharmacology, person. Perfect. Thank you, Prajwal. Santosh, thank you for that. All right. So we have a mix of audience there. If you see,
Yeah,
there are from pharmacy, medicine, and dentistry. So let's work on this ADME process or pharmacokinetics
yeah.
process in such a way that
Okay.
it is helpful to everyone. Yeah, Aditya is from PharmD. He's doing his third year of degree from Government College of Pharmacy, Amaravati. All
Okay.
right, so perfect. Thank you so much, Aditya, for that message.
Okay,
Yeah,
perfect.
perfect.
Yeah. Thank you for that information. Yeah. So let me share my screen. Screen to share. Yeah. Right. So, uh, so pharmacology, I have received a few questions, okay, in advance. The questions were raised like it is difficult to learn the pharmacology, it is difficult to remember, and how pharmacology will help for my career. What are the career options, etc., etc. Okay, as far as I remember, yeah. Okay, and how I can learn in depth of the pharmacology, etc. Right.
Yeah,
So, just as Manoj sir mentioned, it is I like not to have more interact the session to be more interactive rather than just one side. Okay, so it will I believe that it gives us more learning, and also, it is a two-way process. So I can better understand from your questions, and you can also guide me way to, take
absolutely.
the sessions, etc. So
Absolutely.
just before I start pharmacology, how many of you are confident of physiology, anatomy
Very
and
important question.
physiology?
Yeah. How many of you are confident in anatomy and physiology type C or type NC? NC is not confident, C is confident because both the subjects are interrelated. Type C if you're confident in anatomy and physiology. Type NC, not confident in the chat box. Again, let's try to understand so that sir can connect the topic with physiology as well.
Yeah.
C or NC, let's see. Please be as interactive as possible because we
Yeah,
cannot
you can talk. You can
just
talk on
yeah
the phone.
if
If you
anyone
don't
wants
prefer
to
to keep this recording, of course,
yeah we can do that,
will
yeah,
not
that's
publish as
okay.
well. Yeah.
Yeah,
So
yeah, yeah,
here,
we'll not publish this on YouTube and all. We'll just
yeah.
uh, want
So
to
feel
make
free
this
to,
as learning possible. Okay, anybody wants to talk, type T in the chat box. I'll
yeah.
unmute you. Average, so Prajwal says average.
Okay.
What about others? Confident, not confident? Not confident, okay. NC, Santosh is not confident, okay.
Yeah.
That's perfect, no problem. What about others? I want at least couple of responses, guys. Yeah,
Yeah. Feel
confident.
free to,
Lavanya says
be more
confident.
communicate. Yeah.
Yes, yes,
So
yes.
it
Sakshi
is
says not
highly required
confident.
for any career
Yes,
success.
yes, yes. Okay, so we see two confident and rest of them are saying not confident.
So,
That's
okay.
perfectly fine. So if you
Perfect.
could zoom in a little bit so that we can see
Yeah.
what you're
Yeah.
typing
Sure. Sure.
clearly.
Sure. Yeah. Yeah. I
Yeah,
hope it is
perfect. Yeah,
fine.
now it is better. Let's get
Right.
started. Thanks.
So, for you to become good pharmacologist, my recommendation is you should have a good understanding, at least to the optimal level, the anatomy and physiology. Okay.
Yeah, absolutely.
So here the pharmacology, it mainly covers, when you connect to the drugs, it mainly covers pharmacokinetics and dynamics. Okay. So I spoke with many students who are not able to clearly differentiate, the kinetics and dynamics, and also they were not able to clarify what exactly kinetics works and where exactly the dynamics work. Okay. So we will start with this kinetics today. Maybe of course, we cannot be able to complete the fully. So we will start with this one, and maybe in the next sessions we will see, we will to continue to the kinetics and then dynamics. Okay. So here, based on my background, because I'm working on the drugs chemistry, so we will try to connect here the chemistry of the molecule with the kinetics part of the pharmacology. Okay. So the best we can learn, the best we can learn from the pharmacology. So here, as I said, if you are comfortable with the physiology and then pathology, okay, so that means physiology talks about what exactly the current state. For example, if you take a healthy human being, so no diseases, so the body, works on its own. So all the hormones, the blood flow, the liver, the heart, everything works perfectly normal. So probably you already have seen, okay, from your backgrounds, you know how complex the body is, right? Human body is. So everything is interlinked. For example, kidney is linked with liver, liver linked with, both are linked with the heart, and all are linked with the blood. So all interlinked, right? The system is very, very complicated. It is very difficult to understand, okay, even to today as well. So when system is working perfectly, all working to the optimal level. If something, a disease or something, then it has gone something wrong, right? So there we need to diagnose what is the problem. I will today I'm going to take an example like blood pressure, hypertension. Okay, we will start with that one, and we will see how we can move to the next other systems as well. Okay, and here also I'm going to take a drug, ramipril, as an example. Okay, so before I am going to explain further, feel free to ask me to stop and ask any questions, okay, in between. So I you don't need to wait till end of the session to ask the questions. So you can raise the hand and you can ask the questions when you get into your mind, okay? Right. So here the kinetics, to understand the kinetics, we take the drug, for example, a tablet, then it goes into the stomach, of course, esophagus, then stomach, then from the stomach it goes to small intestine, then it goes into large intestine, right? So this is the flow. So when it goes into small intestine, can anyone tell? There are some pharmacy graduates, right? Can anyone tell what happens when the tablet enters into the stomach? What is the first step it is going to be? So we're taking the tablet, so that is a drug. Yeah, here just imagine ramipril drug. And once the tablet is taken, what is the next step? Where it is going? Yes, someone has typed absorption. So it is someone has also typed ADME. Absorption, distribution, metabolism, and elimination. Yeah, many pharmacy graduates they already will. Even before absorption, what happens? So a tablet is a compact unit dosage form, right? So even before absorption, what is going to happen? Yes, perfect. Disintegration. Okay, the tablet disintegrates, and then the next step is dissolution, right? The tablet is going to dissolve, okay, in the stomach acid fluids. And from there, the absorption happens. Some drugs absorbed into the within the stomach to some extent, and but most of the drugs absorbed majorly in the small intestine. Okay, so how What is the pH of stomach? pH of stomach, anyone knows? It is acidic, right? Yeah. It is 2 to 3. Yeah. It is around, yeah. 1.2 to 3 years. Okay, around, yeah. So in that pH, some of the drugs may not be dissolved. So that means the pH of the intestinal fluid or stomach plays a role, okay, to get this drug in, absorbed. So there are two kind of forms, right? Ionized and unionized. Unionized. Okay. So the drugs are absorbed in an unionized form only. If it is ionized, the drug absorption cannot happen. Okay. So here, I'm not sure whether you heard of BCS class. Okay, biopharmaceutics classification system. All the drugs are divided into four classes: one, two, three, and four. Okay. So one is highly soluble, highly permeable. Okay. Second one is high, both um, difficult soluble and highly permeable. And this one opposite, like, sorry, this is not soluble and highly permeable, and this is highly permeable, not soluble, and this is both, not soluble, not permeable. Okay, this is how. So the drugs, the solubility of the drug matters to get into absorbed, to get that into absorbed. Yeah, so solubility matters. Till that time, just remember that one. Then the absorption. Okay, so how the drug gets into absorbed. So there are, so for example, to give an analogy, mm, you know, there is, let's just imagine there is a pond. Okay, on one side, you have put some mud. Okay, you have maybe a big, kind of tub or something you take. One side you have put some mud, and the other side is very clear water. So what happens after some time? I'm very happy if I get responses. Okay. I feel very happy if I get responses, whether it is, all, whatever the answers, whatever
Yeah,
you
absolutely.
thought. Yeah.
There is
So
nothing wrong and right here.
nothing
We're just
wrong
trying
and
to
right.
learn
Yeah. Just
together. So
it's
please
all,
be
I will
responsive
also
here.
learn from your side. Okay.
Absolutely.
As I said, I'm not a pharmacologist. Okay. But I will also learn from you. Just try to reply.
Yeah,
Okay. So
absolutely.
that we can, learn each other.
Absolutely.
So there is a big tub, one side, full of water. One side we have put some mud. Then what will happen? Just logical. Okay. So no responses. Let me tell you. I hope you agree. So after some time, the whole water, becomes mud. The other side, the clear water also becomes mud. What is the reason for that? Okay, let me answer myself. The reason what I believe, from the high concentration to the low concentration. Okay, so the mud particles travel from high concentration to low concentration, and then it reaches to an equilibrium where, it is all equally distributed, uniform. The same, scenario, just imagine, yes, this is nothing but diffusion. The same, you just imagine, when the drug enters into stomach and then to the intestine, what will happen? It should reach to blood. It should reach to the bloodstream. How it will reach? Through a process, it is called diffusion. So it has to cross to the membrane. It has to cross to the membrane. So the how that crosses the membrane? through the process called diffusion. Okay, from higher to the lower. That is one process. So this is one of the major process happens for most of the drugs. Okay. And do you know anyone? The other process? Yes. Osmosis. It is one. Permeability, of course, as we discussed. And then active transport. The other one is active transport. So here there are some carriers. Yes. Which transports from the intestine to the blood stream. Okay, blood circulation. So these are the two steps. So it is nothing but absorption. It is nothing but absorption. Now tell me, uh, can anyone talk? So just would like to understand from you where you are exactly facing difficulty in learning the pharmacology. Is it something to remember about the drugs, or is it something about the process? So if you can give me, little help where exactly you are facing, difficulties, then I will try to, simplify, how to learn.
Absolutely.
Yeah.
Absolutely, sir. And I have given a option to unmute, so all of us can unmute and talk, maybe one by one, if you have any specific doubt, so that
Yeah.
sir will try to clarify. And
Because
please,
though I'm not from the subject, I'm taking this one just to simplify the pharmacology and to help you to learn, easily. Okay, one has said about the process, and another one has said about drugs and process. Okay, anything. So
Can I speak, sir?
yeah, please, yeah, I'm very happy, more
Good
than happy. Yeah.
evening. Good evening. It's a wonderful lecture, and thank you for arranging a wonderful session. Well, I am pharmacist by profession, and currently I am doing a master in pharmacology and toxicology abroad in Russia.
Okay,
So
wow.
nice to connect you. Yeah,
my question to you is that for me it's really difficult to remember the interactions of drug interactions, for example, or particular side effects of a particular drug. So can you please suggest or the any method to memorize those things?
excellent.
Yeah,
Yeah,
thank you.
sure, definitely, I will help you with one example. Yeah, from there onwards,
Yeah,
you can, go forward. Yeah, thank you for that.
thank
Yeah,
you.
any more?
So there are a few messages in the chat box, sir. Somebody, Kishore says process,
Yeah,
Kalpana says remember about drugs and process, and Sakshi says drugs.
yeah, okay, perfect. So I will come to that one. Okay. So this is the absorption. Now just imagine no two persons are, same, right? The same way the drugs, when two persons take the same ramipril, it may not be absorbed in the same way. Okay. So some person, in one person, you can see that 70% of the drug is absorbed. Whereas in other person, it is only 60%. So there is a variance. Why? Because their system, you know, takes that drug differently, takes that drug differently. So, for example, stomach, when it is absorbing, so that person A, liver, try to metabolize fast, whereas the other person, liver, may be slow in the metabolism. So, if it is slow in the metabolism, more drug you can observe in the bloodstream, whereas if the metabolism is high, then less drug. So the liver, because of differences in the you know s- slight differences in the action from the liver, you can see the concentrations of the drug different. Okay, so that is whenever the drug takes into the body, the liver treat that as a foreign material and try to start working, it has some role, right, So it will start working on its role. Then because of that, that metabolism will happen. That is called first pass metabolism. Okay, we call that as first pass metabolism, and it converts into metabolite. Always the liver, what is the duty of the liver? It tries to remove the toxins. It tries to, you know, make the system like non-toxic, right? It converts, molecules into non-toxic way and eliminate from the system. That is its duty, right? It has to perform its duty. But our objective is to drug work within the body effectively and safely, right? So more effectiveness comes from the more bioavailability of the drug. If drug is available more and more, then it will be effective, right? But if it is more and more available for a long time, then what will happen? Toxicity. So the body becomes toxicity, right? Yes, please. Yeah, Kishore has some question. Yeah, please ask.
Uh, Sir, good evening.
Yes, Kishore, please tell me.
Sir, you said that the drug will get absorbed from the intestine
Yeah,
through the process of diffusion, sir.
yeah,
So, sir, then it will go to liver, no, sir?
yes,
So, sir, drug is already absorbed from the intestine, then after it is going to liver, sir.
yeah,
So, in that process, sir, the drug that has already been absorbed from the intestine, it has not
yeah.
been metabolized. It has not been metabolized.
Not metabolized fully, but to
Not
some extent it is metabolized. So before it becomes
okay,
metabolized, fully, that drug should
sir.
reach to the target points.
Okay. So through blood, it will again come back to liver. Then after that, liver get it metabolized. Then it
Yes,
will go to the target cell. Am I right,
yes,
sir?
exactly. Yes, exactly. So what
Uh,
happens? So here, example I have taken Ramipril. So the drug you have taken as a Ramipril, that Ramipril tried to reach to the target, receptors or whatever, the into the bloodstream to the all the areas of the body, right? Wherever the blood flows into more rapidly, it reaches to those organs very rapidly. And at the same time, the liver, it reaches to the liver as well and it tries to metabolize.
okay.
Okay. So all the drug may not be metabolized. Some of the drug goes, just like that, unconverted form. So it is not
Okay.
converting. So the
Okay,
liver also has a capacity, right? So it cannot do 100%, metabolized.
sir.
Yeah.
So, sir, that drug will get excreted like that.
Yes. Drug in both forms, metabolized and unmetabolized, non-metabolized, it will be excreted through the kidneys and through the fecus.
And sir, the drug which we have given, will it be water soluble or sir, it
So
has to be
there
water
are,
soluble?
yeah, as I said, a BCS classification, it could be water soluble or lipid soluble, but the
Yes, sir.
drug, in order to,
Sir,
you
if it
know,
is sir, if it is lipid soluble, so it has to be metabolized. So if it is
yes,
not metabolized, how it will be get excreted, sir?
yes, some drugs, they without metabolization, they can, they are transformed into the water soluble forms. And
Okay,
some drugs, with the lipid form also they are excreted. There are some exceptions, right? All are not working in the same way.
okay, sir. Okay, sir. Done,
Yeah.
sir. Thank you very much, sir. Thank
So
you, sir.
most of the
Thanks.
drugs, they are converted into water soluble forms, then only they will be excreted. Okay. So good questions, Kishore. Thank you so much, yeah, for asking those questions. Yeah. So here, this absorption, the liver is doing its function and it is converting into metabolized form, right? So here in this classic example, in the coming minutes, I will open that Ramipril, a document talking about Ramipril, then you will understand better, yeah. So we have discussed it goes into the blood, right? And from the blood, it tries to circulate into the entire circulation system wherever, okay, wherever possible. And through that entire circulation system, from the circulation, where it goes to the tissues. So that step is called, in the ADME, that step is called distribution. Okay. Next one is metabolism. The third step is metabolism. So this metabolism, even before distribution starts, the metabolism also could start. Okay. Then last step is elimination. So this throughout this process is called kinetics, because body is acting on the drug. It is seeing the drug and it is acting on the drug, how to process the drug, how to work on the drug to make it less harmful, to make it work. Yeah, body does to the drug. Okay, this is the meaning of the kinetics. And exactly the opposite, dynamics. Okay, what is dynamics? So here, as we discussed, it is going into the circulation, then to the tissue, and in tissue, where it goes, whatever the mechanism of action. Some drugs block the enzymes. Some drugs bind to the receptor. Some drug, work on in some other way. Right? So that is nothing but mechanism of action. That means what is happening when it is reaching to the cell, the drugs start working on the body. The drug, it is deciding how to work on the body. Can I block the receptor to make this, to make it work? Or can I stop this enzyme activity? So there are different. Can I go to the brain? Some drugs reach to the brain. Some drugs not reach to the brain, right? Why? Because they have typical characteristics, biological characteristics, each drug. So based on that one, it works. That means how drug acts on the body is nothing but dynamics. Yes, crossing blood-brain barrier. Yeah, please give me, terminology. Sometimes I have forgotten because I am not working in this area. Okay, just I am giving you, the picture, the broad level picture here only. Okay. So blood-brain barrier, yes, that is the right terminology. Crossing. Some drugs cross to the blood-brain barrier or some drugs not. Right? So now we need to deep dive, kinetics, ADME, absorption, distribution, metabolism, and elimination. So here, who will deep dive? Who is going to deep dive? So the pharmaceutical companies, they are spending billions of dollars, to study this one. These clinical studies, they want to perform the clinical studies to see how the drug is absorbed, how much amount of the drug is absorbed, how much amount of the drug is distributed after absorption, and how much is effective. For example, Ramipril, it is only 60 to 70% of the drug is absorbed into the bloodstream. Whereas you take one new diabetic drug, semaglutide, it is just only 0.1% of the drug is working on the body. The remaining 99.9%, it is just, wasting. So how do they come to know? If, for example, semaglutide, if it works 100%, then they have to take very less dose, just in nanograms. But it is not working full amount. They are taking 10 milligrams. Out of 10 milligrams, it is only working just very minute quantity. So the dose, the decision on the dose will be decided in the phase 1 based on its safety, based on its efficacy, these parameters. So that means how much is absorbing, how much is distributing, how much is metabolizing, and how long it is going to be within the body. That determines the elimination phase. Okay, so this is dose proportionate study. Okay, so dose studies will be single dose studies will be studied here, right? Now, when we talk about the distribution, they want to when we talk about absorption, how fast this drug is reaching its concentration. For example, if it is taking hours for a person has a for example, he has got some cardiac arrest, and this drug is taking 2 hours to act on the body. Does no person going to survive? No. That should act within seconds, within minutes, right? So how, for example, if a normal tablet is given, conventional tablet, that is going to be absorbed 20 minutes, 30 minutes, then it reaches to the peak plasma concentration in 1 hour or 2 hours time, but by the time the patient will die. It should not be. Then we have to formulate that drug in a different way. What is that? Sublingual tablet, GTN. So when they take sublingual tablet, immediately he can overcome from that cardiac arrest. Why? Because the sublingual tablet is bypassing absorption. And where it is going? It is directly going into distribution. That means it is directly reaching to the bloodstream. And some drugs, they develop, IV. So intravenous, what happens? Directly you are giving the drug into the bloodstream. Okay, so these formulations, different dosage forms will be decided based on the need, the requirement. So if that drug, in order to reach its bloodstream very fast, we should devise a new formulation. That means the fastest absorption or fastest distribution we should achieve, right? So the formulation, who will decide that one? Formulation scientists talking with the clinical pharmacologists, clinical scientists, they will decide what formulation is suitable here for this drug. So that drug formulation also decided by the ADME process, and it will be decided during the clinical phase studies. Okay, so you see how important to understand each drug, pattern, the behavior. Okay, so next one, absorption, distribution, and then here there is another terminology. Okay, we are talking about rate of concentration, and we are talking about the maximum concentration in how many time, in how much time we are achieving the maximum concentration. And another one is volume of distribution, VD. Okay, so volume of distribution means what happens when the drug is absorbed. So when the drug is absorbed, that absorption phase, then it is going to distribute in the body. So that distribution, how much is distributed? For example, most of the drug resides in the bloodstream. It is not reaching to the tissues. Then what will happen? It is not working, appropriately, because that drug has not reached to the target receptors, to the targets properly. So then the effective action will not be taken, because most of the drug is circulating in the bloodstream. It is not passing through to the tissues. So the VD, the distribution is not achieved properly here. Whereas if the opposite, for example, all the drug reaches to the target, then nothing is left in the blood, then what will happen? So toxicity can increase. Okay, so for example, one receptor, there are many 4 or 5 drugs, competing, and more affinity, it is not leaving. For example, some drug, we talk about the half-life, right? You might have heard this terminology, half-life. So one drug, if you take, that will be washout, that the washout period we call in clinical studies. So one drug after taking, it may reside in the body for 24 hours. Some drugs, even after 7 days also, they cannot go out. Some drugs for months and months, years also, they will stay in the body. So here, how they are going to stay? So the affinity, if they bind, firmly to the protein, they cannot break. It is very difficult to break. So depending on the affinity of the molecule to the protein, it will decide the toxicity and the pharmacology as well. Okay, pharmacology and toxicity is decided based on the affinity of the drug to the various proteins. I hope I am clear until now. Maybe next time I can bring with some slides, what I'm going to talk about here. Just I'm trying to give you a broad picture at the moment here.
Participants, please mention in the chat if it is clear, type C in the chat box. If it is unclear, type UC in the chat box. Let's understand the audience. Clear? Perfect. Thank you so much, Santosh. What about others? Clear? Perfect. Thank you, Aditya. Lavanya, thank you. Good. All right. It's clear,
Right.
sir. Thank you so much. And personally, I also learned a lot. I'm still making some notes here.
Thank you, sir. So let me bring one document over here, and I hope you can see this one.
So please magnify a little bit.
Yeah, sure.
And kindly
I don't
explain
know
what
how
this
many of
document.
you. Sorry.
Kindly magnify a little bit and explain what this document is before we go ahead.
Yeah, sure.
Because some of
I
them are
think
not from
it is too
pharmacy.
much Zoom. Yeah, I hope this
Yeah,
is
this is
fine, right?
fine. This is fine, sir. Yes.
So how many of you know that of the word summary of product characteristics?
Type me in the chat box if you know. Type DNK in the chat box if you do not know. That's perfectly fine.
Any of you know about this document?
Summary
SMPC.
of product characteristics. How many of you know about this document? Type me in the chat box. Type DNK if you do not know. From non-pharmacy, it's perfectly fine if you do not know. But from pharmacy background professionals, we expect that you know this. Related to labeling in the UA.
Yes, perfect. Yeah.
Yeah, very
That
good.
is good.
Yeah.
Okay, thank you so much. So this is a document, preparing throughout the clinical studies, okay, by the pharmacologist, you can say, or clinical expert. You start preparing this document starting from the clinical study and throughout the clinical study. Then by the time issued the license by the health authorities, this document is also will be completed. And this document, we call it as a face of index of a product. That means we will buy a lot of products, right? The phone, the monitor, the laptop, and so many things, right? So what, along with the product, they will give you some literature. They will give you some material, right? How to plug the equipment and what is the, the power and how to use that system, etc., etc. So many. So user manual, yes, user manual, right? For the product. The same way here, it is a kind of a user manual for that approved product. So here we are talking about Ramipril. So this is a user manual, nothing but they, in the scientific terms, they are calling it as summary of product characteristics. So it has a 15-page document, and these will be referred by the doctors, healthcare professionals, because this is, high level scientific terminology, and layman, the patients may or may not understood, right? So it has 10 sections: name of the product, the composition, pharmaceutical form, clinical particulars. This is the main section relevant for our discussion, right? Clinical particulars. That is the fourth section. Next, when we go to the fifth section, the fifth section, that is pharmacological properties. This is exactly the topic we are covering today. So here 5.1 pharmacodynamic properties and 5.2 pharmacokinetic properties, and then 5.3 preclinical. Just to for your understanding, I am going to other sections as well. Pharmaceutical particulars, then marketing authorization holder, who is the company, then MA number, date of first authorization, date of revision of the text. So here we are focusing on this 5.2 section today. Just I am trying to read it out for you. So absorption. Following oral administration, ramipril is rapidly absorbed from the gastrointestinal tract. Rapidly absorbed, okay, from the GIT. Peak plasma concentrations of ramipril are reached within 1 hour. So for this drug, it is reaching the peak plasma concentration. Once we have taken, it is reaching, the maximum concentration within 1 hour. Based on urinary recovery, the extent of absorption is at least 56%, not less than that. Okay, that is 56 or above, and is not significantly influenced by the presence of food in the GAT. So the food is not making any effect on the absorption phase. The bioavailability of the active metabolite ramipril after oral administration of 2.5 milligram and 5 milligram ramipril is to 45%. So as we said, the ramipril is converting into ramiprilat. Okay, and that ramiprilat is observed that 45% is metabolizing into ramiprilat. So out of 56, so 11% is going to be remain as ramipril. Okay. Next, peak plasma concentrations of ramiprilat, the sole active metabolite of ramipril, are reached 2 to 4 hours after ramipril intake. Okay. Steady state plasma concentrations of ramipril after once daily dosing with the usual doses of ramipril are reached by about the 4th day of treatment. Do you understand this point? So steady state. So in the beginning, excreted, but some of the drug is binding and some of the, most of the drug is left. But over the time, by 4th day, what is happening? That is going to be balanced. So that means the treatment comes to a balanced state on the 4th day, okay, to use this usual doses. This is the study they have studied, they have come to know from the absorption. That means they have performed a clinical study for this absorption and they have made this statement based on the study. This is all from the evidence. Okay, they have not written just like that. They are not assuming here. They are giving all the clinical evidences here from the study, and we will also going to see what study they have performed in order to get these points. Then distribution. The serum protein binding of ramipril is about 73%. So the protein binding is 73% and that ramiprilat about 56%. This is metabolite. This metabolite is going to bind 56%, whereas the actual ramipril binding 73%. So this is the smallest information given in this SNPC. Okay. So from this from this notes, few people, they can make out some signs here, and some people they may not understand, right? But who understands better here? This one, the doctors, the medical doctors, they understand here, lot of meaning in this absorption distribution. Okay, based on that one, they will recommend how much dose to be given to the patient. And that's why, some doctors, they will ask you to, take 1 week some drug and to see them back after a week. Why? Because they want to see how the drug is acting on your body, and or vice versa, how your body is acting on the drug. Okay, so this is the meaning. And in the next classes, we will see biotransformation is nothing but metabolism and then elimination process. Okay, so here, this is absorption and distribution. It is linked to pharmacokinetics. Now, today, broadly, I talk about mechanism of action, because we need to understand slightly about this one as well to understand the absorption and distribution. Yeah. So ramiprilate, the active metabolite, it is not a inactive metabolite. It is active. That means the metabolite is also showing its pharmacological action. Okay. So the ramipril is a prodrug. It is converting into active metabolite ramiprilate, inhibits the enzyme dipeptidyl carboxypeptidase. Okay, so there is enzyme, right, in your blood. This ramipril prodrug, this metabolite ramiprilate, okay, it is binding to this enzyme. It is binding to the enzyme. So this enzyme name is dipeptidyl carboxypeptidase 1, and it has another name, angiotensin converting enzyme, and another enzyme also kinase. Okay, these are two different enzymes, angiotensin converting enzyme. So from now onwards, we will call it as angiotensin converting enzyme. For me, dipeptidyl carboxypeptidase, okay, difficult. So it is, in simple, we call it as ACE. ACE. So that's why the class of this ramipril is called ACE inhibitors. If you look into the pharmacology textbook, it is called as ACE inhibitor. We will see. Then in plasma and tissue, this enzyme catalyzes the conversion of angiotensin 1 to the active vasoconstrictor substance angiotensin 2, as well as the breakdown of the active vasodilator bradykinin. Reduce the angiotensin 2 formation and inhibition of bradykinin breakdown lead to vasodilatation. So, as I said earlier, you need to understand the physiology, of course. For example, a student wants to study English literature. Then what he needs to do start? He starts with ABCD, then words, okay, then sentence formation, then progressively. So here, to understand the pharmacology, we should have good basics on the physiology. And after the physiology, then pathology. As I said, a normal adult human being, how the blood pressure regulation happens. Okay. So the blood pressure regulation happens, mainly the circulatory system, blood flow, right? If the blood flow is very hard, that means the heart is pumping, with very difficulty, then the resistance will rise, then it shows as blood pressure. Okay. And the kidneys, if they are not, if the kidneys normally in the normal human beings, what will happen? They balance the electrolytes, sodium, potassium, right? If there is a more sodium, what will happen? That will causes vasoconstriction, and then the pumping, it will, the blood flow with very difficulty, okay, in the pipelines, yeah, whatever called arteries and veins. The same way here, liver does not work properly, it will not release the required enzymes. Then the blood, again works hard, because it needs some elements. It needs some kind of enzymes within the blood, hormones, to work properly, to go smoothly. Otherwise, what will happen? the pipeline, what you call arteries or veins. Okay, so it has endothelium inside the, what you call, it has some layers, right? So they work very hard. That causes the blood pressure. Now, and what else? So here you see many systems are required just to flow the blood properly. What is that? The heart needs to be in the right state, then liver, then kidneys, then lungs as well. You will be surprised. The lungs, you know, the lungs need to work properly, efficiently to have a good blood flow. How lungs are linked to the blood flow? This ACE, what we are talking about, this enzyme, the maximum enzyme, where it resides, in which body part it resides? In the lungs. In the lungs endothelial cells, this enzyme, most of the enzyme is predominantly sits in the endothelial cells of the lungs, where this enzyme start coming. So if there is more angiotensin 2, then 120 by 80 the blood flow. Okay, that means moderate angiotensin 2. If the more angiotensin 2 happens, what will happen? Constriction. Now what is our role? We need to break that flow. That means angiotensin 2 we should stop. How we stop? There is a chemical reaction, right? There is a reaction. Angiotensin 1 to angiotensin 2. It is converting angiotensin 1 to angiotensin 2. We need to stop that one. How do we stop that one? I have brought a inhibitor. What is that inhibitor? Our ramipril. We have brought our ramipril. We put, towards that reaction. So it stops from 1 to 2. Am I clear? I would like to take, your opinion, whether I'm clear or not, to go to the next step.
Yes, participants, did you find the explanation clear? Type C if you found it clear. Let us understand the response from all of you. Clear? Perfect. Thank you, Santosh, for responding. What about others?
Anyone not clear, please tell me.
Type NC if it is still not clear. This is the time we want to
Yes,
maybe
because
stop
we
for
are
a
going
second
to
and break. Yeah,
detail of the subject. Yeah, this is critical for
absolutely,
us to
absolutely.
understand.
This understanding is very much for you to extrapolate your learnings faster. Okay, perfect. Thank you, Sapna. Thank you, Shreya. Thank you, Kalpana. Thank you, Manjula. Thank you, Aditya. All right, perfect. Thank you. Let's continue, sir.
Yeah, excellent. So here, as we said, we are classifying the drugs into different classes. And this is one of the area from the physiology and from the pathology. So the blood pressure, the hyper blood pressure can happen because of various reasons. One of the reason is this one, this angiotensin 2 more is forming. Where it is forming, what is actually, first of all, the origin of this angiotensin comes from the liver. Liver gives angiotensinogen, that is converting into angiotensin 1. And from the angiotensin 1, then there is a hormone kind of enzyme, renin, where it is on the kidneys. It is with the kidneys, right? It is close to the kidneys, near to the glomerulus. That renin, it is converting that angiotensin 1 to angiotensin 2. Now we are giving this ramipril to stop that chain so that angiotensin 2 will not be formed. If it is not formed means the blood vessels relax. If blood vessels are relaxed, then hyper blood pressure come down. 50, 160 becomes, close to 120. Because They are not pumping very hard. They are trying to relax. Okay. So here, that is one enzyme. And there is another one also mentioned. What is that? Kinase 2. What is that? It is kinase 2 is one of the enzyme that forms bradykinin. That forms bradykinin. So, one second, sorry. Yeah, that forms the bradykinin. Bradykinin is one of the enzyme. So this bradykinin, it has a property to make vasodilatation. Okay, vasoconstriction opposite vasodilatation. So this bradykinin, it makes the blood vessels to relax. Okay, so here what happens? It is, for the blood pressure, to moderate, it needs to break down the bradykinin to the optimal level. When we take this ramipril, what happens? It stops that process to increase more bradykinin, to increase the level of bradykinin. If the bradykinin levels are increased, automatically that will help to relax the blood vessels. So there are two processes happening. One is conversion of this angiotensin 1 to 2 is stopping. Then the conversion of the stopping the breakdown activity. Obviously the bradykinin will go up and relax more. This is what I understand from here. Please correct me if something wrong from my understanding. Yeah. Then reduce the angiotensin 2 formation and inhibition of bradykinin breakdown lead to vasodilatation. Yes, this last sentence has given us a proper, clear information. Okay, reduce the angiotensin 2 and then inhibition of bradykinin breakdown. So we are stopping the breakdown of bradykinin. They both combined synergistically working to make the vessels, blood vessels to relax. Since angiotensin 2 also stimulates the release of aldosterone, ramiprilate causes a reduction in aldosterone secretion. The average response to ACE inhibitor monotherapy was lower in black hypertensive patients than in non-black patients. So it is different from the race. So the effectiveness is different between black and non-black patients. This is how do they come to know again here from the clinical studies. Okay, right. So this is mechanism of action. Now we will go to again pharmacokinetics. You read it again now. Following oral administration, ramipril is rapidly absorbed from the gastrointestinal tract. Peak plasma concentrations of ramipril are reached within 1 hour. Based on urinary recovery, the extent of absorption is at least 56% and is not significantly influenced by the presence of food in the GAT. The bioavailability of the active metabolite ramiprillate after oral administration of 2.5 mg and 5 mg ramiprillate is 45%. Okay. Peak plasma concentrations of ramiprillate, the sole active metabolite of ramiprillate, reach 2 to 4 hours after ramipril intake. Steady state plasma concentrations of ramipril after once daily dosing with the usual doses of ramipril are reached by about the 4th day of treatment. So that means here the 2.5 milligram, for example, let's say 56% is absorbing. That means 56% of the drug is only available, to show its action at the dynamic sites, that is enzymatic activity. The remaining is going into waste.
Absolutely, absolutely.
Okay.
And this is a very good point, and this totally depends on the race, as you said. For
Yes.
example, I'm little on the black is complex, and if
Yeah.
a doctor prescribes me, then
Yeah.
the metabolism of the product will be a little different in my
Yes.
condition. And if
Yes.
somebody has a white complex, then the
Yeah.
metabolism of the product will be different. That is
Exactly.
where the mode of personalized medications are coming into picture these days.
Yeah.
We look into so many different things before we prescribe any
Yeah.
medication to the patients. Thank you so
Yes,
much, sir.
exactly. That
Perfect.
is,
Thank you.
CYP enzyme, we call it as in liver. That a CYP enzyme activities and the levels also, the amount are different, between the races. So here that enzyme is the one which is causing this metabolism, okay,
Absolutely.
which is affecting
Yeah.
this metabolism. So if that enzyme may be more, if it, for example, in the black patients, I am not sure, okay, I need to go into detail. Then what will happen? More metabolism will happen. The lesser drug is available for the
Yeah.
activity, therapeutic activity. That could be the reason. Just I'm guessing, yeah.
Absolutely.
So
Yeah.
this is now I'm coming back to your questions. Okay, there were some questions right already asked online, and also when I have checked, offline and online. So there were questions. It is difficult to understand the process. It is difficult to remember the drugs. Here, the memorize, I am against to the memorization. I have studied in my childhood. Once, I am not, I was not comfortable, and I have find my ways, to remember the things. How we remember? If you know well in depth of the subject, anything, you don't need to memorize. Okay, you need to understand the concept. You need to understand the concept. Here, just if you are still believing that memorization, leave that memorization. Okay. Of course, memorization just, it may help you to get some marks or something, but it will not make you your career, path, and it will not make you happy also in the learning process. It is very hard, to study with memory. So, how now this one, if you understand ACE inhibitors, angiotensin converting enzyme ACE inhibitors, all the ACE inhibitors ending with pril, ramipril, enalapril, captopril, lisinopril. Can someone help me? Different prils? Enalapril, lisinopril,
Participants,
captopril,
let's
ramipril, bisinopril, something is there, starts with B as well. Bison, yeah, some pril. Okay, so there are different prils. So it is, all the prils, all the ACE inhibitors work with the same mechanism of action. Now, do you think it is difficult to remember? It is not.
how many of you think it is still difficult to remember? Type me if you still feel it is difficult to remember. Type NM, not me, in the chat box. We're trying to make it easier for you.
So
Listen
here
up, really.
I have
Okay.
just told you one approach how the blood pressure, maintained. In the same way, there are eight or seven, there are different ways, the blood pressure is controlled. If you understand that physiology along with pathology, then you will understand the pharmacokinetics. Okay. So some other, heart, from the heart, because of heart, it could cause blood pressure. So you need to understand that pathology. So the doctor will try to diagnose what kind of, patient it is. Is he getting because of more sodium, or is he getting because of, some kidney issues, or is it because of liver, or is it because of heart, or is it because of lungs? So he try to diagnose the actual, the origin of that hypertension. Then he will prescribe the right medicine which works for that pathological action, because they work differently. Only one class I have, talked about here, just ACE inhibitors. There are different classes. Okay, so this is, I think we are almost 1 hour, right, Manu sir? So
Yes, sir.
I think I will stop here for today because it is a lot of subject. And next class we can talk about this uh, therapeutic indications, how this posology, how we have decided
Absolutely, sir.
is special populations.
Absolutely.
Okay, where is that? Somewhere. Okay.
I want to share one of my experiences that
Yeah,
happened
please.
today at IPC.
Yeah,
So, a couple of companies came for recruitment at
yeah.
IPC, and they were
Mhm.
giving spot offers to some of the candidates who performed exceptionally well at the interview.
Yeah,
Okay, and it was a spot selection. Many candidates they got offer letters, and the questions were all basic. They didn't ask
yeah,
any technical, too much of information. They just asked the basic information. And those candidates who answered the questions perfectly and showed the confidence of learning. That is another important point to note.
yeah.
Were given spot offers. So we
Mhm.
need to show either the curiosity or we need to show the confidence in learning, or we need to have learned the basics when we are passing or going for an interview.
Yeah.
So this was a spot example, and I interacted with almost five, six HRs from different companies, and this is what I got to know from them. And some of them they are giving offer letters tomorrow. Some of them they already got today. So the objective why Venkat sir agreed for these kind of sessions is to help you understand the basics and not memorize, as he told clearly. Once you understand, you can visualize and focus on how the drugs and the mechanisms can be connected. And one question that I often get is, sir,
Mhm.
do we write notes? Does flowchart making helps? To understand the concepts, what is the easiest way to make notes? Because I see a lot of pharmacology students making charts, classification, flow charts, then tables to memorize things. And as you rightly said, we don't want to encourage with just blank memorization. We want to encourage understanding over a period
Yes.
of time, and that
Yeah.
happens when we have learned the subject in depth.
Yeah.
And that happens again if you are really, really curious to learn the subject itself. Right.
Yes.
What are your thoughts on this, sir?
So here notes, if I have also when I was studying pharmacy, I used to bring notes from the intelligent students and to memorize before the exams. This is a usual practice, but that we are in the technological world now. Okay,
Yeah,
so
absolutely.
here every country is advancing, so we should think differently. Okay,
Yeah,
so
yeah,
here you learn just a few things only. You don't need to learn everything. Okay,
yeah,
but
yeah,
whatever you learn you should try to learn in depth. That
absolutely.
notes, it will help you. Of course you need marks as well. Okay, to prove to the outer world, okay, where you are and how you are compared with because it's all comparison world, right? We are now in the
Yeah,
comparison
yeah,
world. So I
yeah,
have got 90%, I have got 95% like this. So that is important. But even that memory also, should come from learning, in-depth learning. So
absolutely.
I am giving you 100% assurance. If you learn in this detailed way, that memory also very easy. Okay, memory is also very easy to memorize. But
Sir,
here,
connected to that, there is, sorry to,
yeah, yeah,
intervene here.
yeah,
Many students, they say that time management becomes a challenge if they want to learn, in detail. Uh, I know personally a couple of students where, I have spoken with them and asked them to learn, for example, Goodman and Gilman and other
mhm,
pharmacology textbook, but they prefer to still go for those small, thin textbooks where the classifications are mentioned and the memorization becomes easier. So, given the kind of time these students have, what is our suggestion to them to ensure that they are learning really, really in deeper way, and whatever they are learning is definitely stronger, and they're able to reproduce at least most of the content they have remembered through understanding the topics.
yeah. Yeah, I understand their concern in industries also, in companies also. Few people they don't plan,
Yeah,
organize. Okay, they
yeah,
want to give more output. but this
Yeah.
more output comes from well planned and well organizing the things.
Yeah.
Okay. In the beginning, they think that they don't want to spend time anything on the planning. They just want to do, on all on urgent things. But this
Yeah.
urgency, where this urgent things comes, because we are not well planned, we have not, smartly worked what important things, to work. So if you start working on the important things, automatically the urgency will come down. You will get a lot of time. The same way
Absolutely.
here, in the beginning, to do a deep study, the well comprehensive study, it takes more time. Once you are familiarized with the things, you can narrow down your learnings. You can make it as a guide or, small notes that will help you, to short, your summarize your learnings in a shorter way for the exam. So in the
Yeah.
beginning, you feel like you are spending more time to learn, but over the time, it will help you, to get more marks and also to get prepared for the competitive exams. Okay. And another thing also, because you are studying pharmacy, let's say pharmacy as an example, you are studying different subjects, pharmacology, sutics, chemistry, pharmaceutical chemistry, medicinal chemistry, then pharmacognosy, then pharmaceutics, right?
Yeah.
There are different subjects. You feel like they are all, different subjects and they talk about different things.
Yeah.
But once you understand in depth and comprehensive, learning, you will realize they are all interlinked.
Interlinked. Yes, absolutely.
When you interlink them, your learning will become easy.
Yeah.
I know we have several years of experience and we have come from that one. When we were at the same age, we were also, thinking like this because we had, traveled so much. Now we want to give you advice. Don't do the mistakes what we have done in the
We
past.
did. Yes, absolutely.
Okay. So here it is an opportunity. It is a, AI world now. It
Yeah.
is, you can learn abundant things. It is just to try to implement them in a practical way. For example, something you don't understand about blood pressure drugs. Maybe you find some mentor to understand, or you can work, part time or few days in a medical shop so that you will be familiarized what kind of antihypertensive drugs. Or maybe
Absolutely.
visit some hospital in which situations doctor is prescribing those kind of drugs. Then come home and try to interpret what you have learned in the real scenario. So
Absolutely.
that way, these notes, of course, always put it in writing on your own. So it will help you to memorize and to learn also. You will get new thoughts. Why this ACE inhibitor, sitting in the lungs? How these lungs are linked? So you will get more curiosity. Of course, you need passion, right? Just passion, it will, if there is a passion, the learning also will be very easy. If there is no passion, then it will become very hard. My
Yeah.
younger
Yeah.
son, he is not study. He is now became passionate to play, what is that, basketball. And 3 hours, 4 hours, he is not feeling tired. Whereas to study 5 minutes, to open a book, he is feeling tired. So it is making him more passionate. He is curious. So if there is a curiosity and passion, it will not, you get tired, right? It will not.
Absolutely.
So the same way here, but how you need to enhance your passion. You need to improve your passion. So if this is the one you are going to want, you want to establish career, then study like, as a passionate learner. Just just do study, just because of marks, don't study. To get
Yeah.
marks, it doesn't help to my knowledge. Yeah.
Yeah, yeah, I think that very good point you have told,
Yeah.
sir. And whether it is pharmacy or medicine or nursing or any area, most of the subjects are interrelated, interconnected. And unfortunately, when we are at the college level, we don't understand this. We come out of the college and then we understand, oh my God, these subjects were so interconnected, and this is how these applications can be done. But the challenge is by the time you realize this, it is already too late. You cannot go back and study, right? So
Yeah.
at the initial stage, if you're able to connect, And I think one of the best ways, one of my mentor was saying that if you can connect with real life case studies, then the learning becomes very, very easy and very, very good. So in pathophysiology, for example, in biochemistry, for example, in pharmacology, for example, you have a lot of case studies which are published these days, right? And these cases, when you go through these cases, then your learning becomes automatically very, very stronger. And then you
Yes.
start analyzing the things, and then start analyzing as to why this is happening, right? And how to connect. Because when you read a case series or a case study, you actually understand the entire subject areas, right? Not just pathophysiology, not just pharmacology, not just human anatomy and physiology, not just biochemistry, but as a 360 degree, you try to understand these subjects, right? By applying this knowledge through case series. And don't worry about making mistakes. When we read case studies and try to interpret them, we feel okay, maybe after 2 3 cases, or analyzing 2 3 cases, we could make out only 1 or 2 cases, and then we start feeling depressed and upset by, because why? Our mind wants instant gratification,
Yeah,
right? So
exactly.
focus on that, and then don't focus on instant gratification. That never happens and helps.
Yeah.
And definitely that was a very, very good point, so thank you so much for that.
No problem. So just I would like to know if anyone have any questions here before we
Absolutely.
close
So
the session.
now all of you can simply unmute yourself and talk. How did you find this session today? Let me know. Let me and Venkat sir know, because this is coming out through our experiences, Venkat sir's experience as a pharmacologist, and definitely in the process we learn together. And making notes can definitely help. That is what I feel, and I have been making notes for like many, many years. It's been 17 years of my journey, even after the college, and I'm still making notes. And I feel
Sorry,
that
sorry.
really
Just
helps.
one thing I want to
Yeah,
add
please, sir.
to the
Please,
question
please.
raised by
Yeah,
Jane.
please.
Okay, she has a sorry. They have asked about how the adverse reactions comes. Jane,
Okay, okay.
yeah, could you, if you are on the online, so
Jen,
that is the question, right?
I don't see her or him in the chat box or in the group here. So participants, you can all unmute yourself and talk.
So
How did
as
you
I
like the
said, the
session?
ACE enzyme, mainly concentrate on the lungs. That's why when the patients are taking Ramipril, they feel dry cough.
Yeah. So it's a
So
side
because,
effect.
yeah, it is as a side effect. That is how the side effects are formed, for the drugs. 1 second here, it is uncommon, rare, very rare.
So you're not sharing the screen. I
Common,
had
yeah, common.
disconnected. So in case you
So
want to share the screen
common
and talk.
is a dry cough here. It should be there definitely. You see, non-productive tickling cough, bronchitis, sinusitis, dyspnea. Okay, so
Yeah.
this is the one common symptom when we are taking Ramipril. Okay,
Yeah.
so this is linked with lungs.
Absolutely.
Okay,
So
so
do
if
you want to
you
send the
understand the
document?
mechanism of action, then at least we will get a idea
Clear
about the
picture.
side effects as well. This is what I want to
Absolutely.
say. Yeah.
Yes, absolutely, sir. So do you
Yeah.
want to send the document to these participants
Yeah,
just
yeah,
for
sure,
the
sure, I will.
reference?
Yeah,
Yeah.
I have
Okay.
actually downloaded 3 more documents.
Okay.
Levetiracetam as one example. Of course, we did not get time.
Right, right.
Okay, just
You may
to,
share in the chat box if you want, or if you want me to send an email to those of them
I
who are
will try to
participating.
share in the chat box if that helps. Yeah,
Yeah, yeah,
Java
perfect.
printing as
So
well. Yeah,
participants sir will be sharing a document or 2 documents in your chat box on Zoom. Please
yeah.
save that. And in case you're not able to do that, you can send a message to me later on and we'll share those documents. Go through this document in a very curious manner, understanding why this is happening and why this drug is acting in this way. And then definitely when we meet in the next class, you'll have much, much better clarity in understanding these topics. All right. No, nobody responded, so I'm assuming that it was a good class or maybe a bad class. We don't know, because unless you respond in the chat box, we don't know what is happening at the back end, right? Maybe all of you are sitting comfortably and enjoying the session. That's what we assume, and that's the reason we are doing these sessions. Was it a good class or a bad class? Let us know. Did you understand something today? It was a great session, says Prajwal. Thank you, Prajwal. Good class, says Kishore. Thank you, Kishore. And please go through these documents. Yeah, the documents will definitely, and these documents come from pharma regulatory, but this is definitely something that each one of us can definitely learn from the document. You'll also understand how your area of expertise, let's say pharmacology, medicine, pharmacy, is interconnected to regulatory approvals, how the approvals happen, because these documents are common for every single drugs that are approved. Yes, sir. Am I right?
Yes, yeah, that
Yeah.
is very correct. Yeah. So even for these graduates also from their studies, if they interlink their learnings to the real world, pharma world, how the drugs are approving, and try to access, some different drugs. For example, in the pharmacology, if they come across gabapentin, it is difficult to remember, right? Gabapentin, which class and all. If they can look into this gabapentin approval from the public domains, then they will
Yeah.
easily understand. Okay, they
Yeah.
can remember easily. Yeah.
Absolutely, sir.
Yeah.
So if you have those documents handy, sir, could you share in the chat box,
Yeah,
please?
please. Yeah.
Some of
Yeah.
them are asking.
Yeah. So I can upload it here, right? From
Yeah,
chat.
yeah. Just click on that uh, file icon, that is the fourth icon in the chat box. And once you click on the file icon, you should be able to upload from your computer.
File, 1 second. Yeah.
The fourth icon in the
Yeah.
chat
Yeah.
box, sir.
Fourth icon. Yes, I can see. Then your computer downloads RAM April. One by one I have to do, or
Yeah, yes.
together? Okay.
I think you will be able to share all of them together.
Yes, yeah.
Yeah.
Yeah, I
And
have shared
participants,
it now.
once you
Yeah.
have downloaded, type D in the chat box so that we know that you have downloaded the documents.
Yeah,
Go
I
through
hope
the
you have received
documents
it
and
now.
they'll
Yeah.
definitely help.
Yeah.
So participants are saying this session was absolutely good and great learning session. Thank you so much, Manjula, Shreya, Sakshi,
So are you
Prajwal.
interested to have more sessions?
Yeah, type that
This
also,
is
yes, because this was the first session. We just wanted to understand the pulse of the participants. And yes, we want to do it on larger scale. And definitely we want to do it maybe on Fridays or Thursdays, depending on sir's availability. And the timing will be same, 7:45 to 9:30 max. We want to do that. Okay, we need more sessions. And Kishore says yes. And Manjula also says certainly. Thank you. All right, perfect, sir. So thank you so much. I think we had a great session today. And personally, I was able to learn a lot of things. I'm not from pharmacology background, but definitely my interest in pharmacology is very, very high. And thanks to my, domain, that is medical writing. So I've been on medical writing for like 17 and a half years, but every day I feel learning pharmacology could have been definitely a savior for me.
great. Yeah.
And sir has made those learnings definitely easier. So thank you so much, sir, for that.
Thank you.
And
Thank you very much, yeah, for this opportunity. Yeah.
thank you, sir. And we'll definitely meet again and continue these sessions. So, participants, thank you so much for your time and keep learning and stay blessed. We'll meet again next session. So, I'll be sharing the details in the groups. So, whatever groups you are, please, or you can follow me on LinkedIn. So, or sir on LinkedIn. Normally, whatever we post, we share, tagging each other. So if you're following either sir or me, you'll get a notification of these sessions. All right. So thank you so much, sir. And thank you so much again, all the participants for your time. We'll meet again. Thank you.
Thank you. Thank you, everyone. Bye.
Thank
Bye
you,
for
sir.
now. Thank you. Bye.
Thank you, sir.